Can you see the slide?
Sure. Yeah, we can see it clearly.
Okay.
Okay. Okay. Let's start. Okay. Today, I would like to thank the chairman, Dr. Huang and Dr. Lee. And today's theme is to talk about treatment strategy for all layers skin rejuvenation with melasma. Solar lentigo and melasma often coexist, and it is necessary to consider controlling melasma when you treat pigment spots. This is a pathological mechanism of melasma. How to control the activity of melanocyte is the key. Managing external stimulation such as UVB and physical stimulus is the top priority. Hormones are difficult to control. Tranexamic acid blocks several melanocyte stimulants. Antiplasmin is very effective for suppression of stimulants.
We should get the information, everything about the previous treatment history of patient. If the patient has no history of treatment, we can start treatment of my own routine. But if anybody has a previous treatment history, you should think about that one. And the previous treatment may load it too much thermal damage still on the skin regions. So after we consult the patient, we should give skin barrier recovering time, and we should give education to fix the habit of makeup removal and the facial washing habit. As you know, all the skin type is divided into 16 groups by Dr. Baumann. And among the 16 groups, melasma is mostly common in these 8 types. And these dry sensitive pigmented type and dry sensitive pigmented wrinkly type is most tricky to continue the treatment.
So can you see my slide?
Yes, clear.
Professor Huang, can you see my slide?
Sure, very good.
Now, okay. So good afternoon, Professor Wang. Good afternoon, Professor Lee, and every speaker online and every audience online. Thank you. I should thank Professor Huang for inviting me to this seminar and make a discussion with every one of you. So today I'd like to talk about the efficacy and safety of picosecond laser treatment for melasma. And as Professor Wang introduced, I'm Dr. Lu from HUANG Hospital, Fudan University. So currently, picosecond 1064 YAG laser is now very commonly used in the treatment for melasma. And in our practice, either the zoom mode or the resolve mode is used. And some doctors will combine these two modes in the same session. And our experience is that the treatment interval between each two sessions cannot be shorter than 4 weeks. If the interval is more than 4 weeks, that will be better. So the interval should be longer than 4 weeks. And usually, my opinion is that totally 5 treatments will be okay. And if you exceed 10 sessions of treatments,
but we usually use laser treatment combined with drugs. Most of them were combined with topical drugs. So this is LIOB. What we did when we used the 1064 picosecond laser, and we use low energy, low fluence, 1.3, you see the small bubbles, vacuoles on the in the epidermis, and if we raise the fluence, raise to 2.1, and we can see it turns bigger. And then if we use much higher fluence, we use 2.9, so we can see the changes. And we can also see inflammation in the dermis. But if we check the small fluence, we can only see we cannot find very severe inflammation in the dermis.
Job to be done in order to have a good results, like the stabilization, reconstruction of the structural damage, as we mentioned, the basement membrane problem. We'll remove the vasculopathy, scavenging the free radicals, anti-inflammation and hormonal balance management, etc. And for the lasers that I'm going to share with you is contributing 10 to 90% of improvement. Yes, it is 10 to 90% because different types of the melasma really differs in terms of the outcome. If all we agree on that. So therefore, we need to make a good categorization or the diagnosis before we proceed to which kind of treatment we are imposing on our patients. And therefore, from my little experience, I've categorized them into 8 different types. First of all,